a YouTube video as well. Okay, so what I'm going to do here is I am going to go ahead and show you my sequence on the lower limb. First and foremost, how do I undrape here? Well, I'm going to come here, I'm going to pull this up. I do have a towel somewhere. Where's my towel? Maybe I have a towel. Oh, there it is. I found it. So if I was doing a lower extremity, I would remove the sock, obviously, right? Okay. I'm going to try to get this so that it's up above the heart and making sure that the knee is supported. Okay. So the ankle, so that a lot of you I saw in the first video that you had the knee elevated and the leg hanging down. So you want to make sure that the whole limb is somewhat supported here and that the foot is actually above the heart, okay? I'm going to come in here, and once again, when we're draping, a lot of times what I'll do is I will kind of stick the towel up underneath there, okay? I've already asked for permission. I've already cleared contras and precautions. I've already sanitized my hands. I have my medium here. I've already asked her about allergies to creams and lotions and all that stuff. And I'm coming in, and I'm just going to do a lower extremity sequence here. I'm going to start with the stroking, okay? Remember, stroking can go in any direction. I'm very, I'm firm, but I'm soft. So I'm not really pushing in. I'm making sure that my hands are completely on the limb, though. I'm not tickling, okay? You don't want to have fingers. You want your palms touching. I'm getting the lotion on as much as I can here, okay? So let's say she has some knee swelling and ankle swelling, okay? So I've gotten the lotion on. I just did that for about a minute or two. I'm communicating with my patient the whole time, making sure that she is comfortable, and then I'm going to go into my effleurage. Now, this is the one thing I want you guys to remember, the effleurage. It is that kind of snowplow squeegee. I'm going in, I'm going to the knee, and I'm pausing, coming with the other hand, okay, 7 inches per second, and pause. So always make sure that even if the one hand is starting the stroke, and I actually would like to have this even up a little higher here if I had an extra pillow or something, okay? Make sure I'm pausing. The other hand is coming on. Now if I choose to do it with 2 hands, I'm snow plowing, squeegee, 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 and I'm going to come up here, brief pause, and then keep my hands on, use a stroking technique on the way back, okay? There we go, okay? And then what I would do is probably come above, avoiding any scars or incisions, and go ahead and push the fluid towards the inguinal sheds here, okay? You can make sure that your hand is getting kind of circumferentially around the entire limb if you have to, okay? But you guys, it's a very specific pause at the end, okay? My physiologic rationale for this, okay? I am moving fluids, primarily interstitial waste, and I'm improving venous flow. I am trying to remove anything that is stagnated in there. And when I do that, what happens is because the venous flow is improved, it now returns the fluids to the lymphatic system, returns the fluids to the cardiovascular system, and it allows for the good blood to then get in. So by pushing all that out, I am, in essence, allowing for the circulation, arterial circulation, to then come in. What does that do? Well, it brings in good fresh blood, brings in good nutrients, allows for the exchange, the cellular exchange of energy and all that stuff, okay? So that's what we got going. So if I had muscle spasm in the quad, my effleurage would also have the benefit of bringing in new circulation, because we know that muscle spasm is ischemic overfiring of those sarcomeres. So if we can get new blood in, and then the compression of the effleurage will hopefully remind that reflexive overfiring of the sarcomeres to kind of chill out a little bit, okay? So effleurage for the sake of reducing edema, and also effleurage for the sake of reducing muscle spasm, okay? I could also use it if I had superficial scar tissue. You guys already know that. So now, also, if I feel as though she's got some thicker edema and I want to do some thumb pad kneading here, I can use my thumb. I can come in these areas and move. If I feel like there's certain areas of pitting edema, I might come in and address them with my thumbs, circular thumb pad kneading, or my fingers around in here, okay? You can mix up the techniques based on what the patient needs. So in your scenarios that you have for your skill checks, they're not very specific, right? For the scenarios that you'll have for your practicals, you guys will have to pick and choose some of these techniques based on the specific areas, okay? So now let's say she has a quad muscle spasm. Okay, I'm going to come in once again. I can do some picking up here, all right? Picking up is grabbing that muscle, up and down that muscle belly. This will kind of separate those fibers if there's any adhesions or scar tissue. Once again, it'll get the blood flow coming in to reduce any muscle spasm, allowing for that pain spasm cycle to kind of be damped down a little bit. We're also getting pain relief via gate theory, okay, those mechanoreceptors, those A beta fibers, right? Because this is a distracting sensory input for those at the spinal cord, okay? All right, ringing back and forth this way. This is my ringing. All right. And then once again, because I just did some thumb pad kneading at the ankle and now I'm doing some petrissage in the thigh, I may go back down and just go ahead and finish up with a minute or two again of effleurage, right? Because I've stirred up all the waste. I've gotten a lot of stuff loosened up and I want to send it in a place where it's not going to sit there and cause more problems, okay? And you don't have to do this last stroke, you know, for 20 minutes. It can be 1 or 2 minutes, okay? And come above the knee, all right? Okay, so you see how I'm being very methodical, specific, nice and slow, nice and rhythmic. I'm watching my body mechanics. I'm moving my body. I'm not trying to lean all the way over like that, okay? At that point, I would probably just finish up with some stroking, unless if I wanted to do scar tissue. So if I want to get on the scar on the knee, maybe do some cross friction. So let's say she's 12 weeks out of a total knee, or maybe she's got a patellar tendonitis. So even if it's the same scenario here, now what I want to do is I want to put a little stretch on that patellar tendon here, okay? So I can come in and I can do some cross friction here on the scar. If it's not completely healed, so it's still in that acute or subacute, I can still put it in this position to patient tolerance, and I can come around and do some thumb pad kneading around the periphery of that scar. Okay, we talked about that on the quiz a little bit, right? Okay, this is basically, from a physiologic standpoint, it is kind of realigning those collagen fibers, breaking up any underlying adhesions. Once again, reminding those fibers which direction they're supposed to go in. And if the scarring is chronic at this point, my cross friction will break up the tissue and jumpstart that inflammatory process a little bit, okay? If it's not a chronic scar, once again, I'm going to go on the periphery, okay? If it's chronic and I don't like what's going on, I'm going to break it up. I'm going to allow the body to start rehealing, okay? So that's lower extremity. Any questions on any of those strokes, guys? Those should all look pretty familiar to you at this point, right?
I have a question.
Yeah.
For effleurage, if you're doing past the knee,
yeah.
Do we have to go all the way towards the inguinal lymph node?
As close to the hip as you can get would be the best, because that's the next closest shed. Okay. And if you only push it halfway up, and then the patient... Are you... Somebody murdered?
Sorry. Someone scared me.
Oh, okay. But if you only push the fluids halfway up and you don't get them all the way to the shed, once they get up in a dependent position, chances are that fluid's just going to come back down. Because it wasn't absorbed. Remember I say the squeegee pushes it towards the drain, circles the drain, and goes where it belongs. If you don't get it all the way to the drain, chances are they get up and it's just going to come right back down again. Okay. And then you're also risking less circulation being able to get in. You know, because if the venous system and the lymphatic system and the interstitial waterways are plugged, the good blood can't get in there. There's no place for it to come in. Okay? Anybody else? Okay. So now let's say I just did these techniques on Casey's lower extremity, I'm going to come in and do a little bit of relaxed passive motion now, okay? So remember we talked about 3 to 4, little distraction. Let's say she's in a chronic healing phase, so I'm not worried about disrupting healing tissues or anything like that. I might just come in a little distraction, a little overpressure. Okay, 1, 2, 3, 4, maybe internal, external, or I'm sorry, inversion, eversion. Okay, so all the motions of the ankle. Then I'll come in a little traction here. Okay, I can do knee and hip at the same time here. Slight traction, slight overpressure. Watching my patient's response the whole time, not pushing into pain. But once again, this is more like stretching than passive range, okay? Physiologic rationale is to try to really lengthen those tissues that have been kind of stuck down so they remember what their elastic qualities are supposed to be, okay? I can come and do some internal, external rotation here of the hip, okay? Just a little overpressure, okay? I can do a little AB, adduction if I want to, okay? But I'm just kind of moving those joints around just to remind them how they are supposed to move. Once again, not if there is a reason why we shouldn't be moving that joint. If it's in an acute phase of healing, stick with passive range motion. This would be definitely for something that is more chronic, okay? All right, so I would like to do a sequence on the back. I'm going to stop my video here.